Hello mothers and mothers-to-be, welcome to our podcast where we will talk about the Tdap vaccination, the loving protection from mama to baby. Joining us today is a Professor Datuk Dr. Zulkifli Ismail, a consultant pediatrician and the technical chairman of Immunize for Life. And the next to him is a Professor Dr. Jamiyah Hassan, a consultant obstetrician and gynecologist and Fetomaternal specialist from UiTM Shah Alam. She is also the chairperson of Maternal Immunisation Guidelines and the past president of Perinatal Society Malaysia. Welcome to this podcast today.
Thank you.
Good news for all expectant mothers. Starting in 2025, the Ministry of Health has begun offering the Tdap vaccination to all pregnant women. Perhaps Professor Datuk Dr. Zulkifli could explain more about this initiative, including how it works and what expectant mothers need to know.
Thank you.
Welcome.
For the first time, the Ministry of Health is giving the Tdap vaccine to all mothers free of charge at the gestation period of 28 to 32 weeks. And any mother can go to a clinic, a government clinic, and get the vaccine, but she needs to get it every time she's pregnant.
Okay, we go back to Professor Dr. Jamiyah. When it comes to the recommended timing for the Tdap vaccination during pregnancy, Professor, we understand that is generally advised between 28 weeks and 32 weeks. Professor, is there any flexibility in this window? Can mothers receive the Tdap vaccination earlier than 28 weeks or later beyond 32 weeks?
The Tdap vaccine can be given earlier than 28 to 32 weeks. So if you look at the guidelines around the world, it starts to be given Tdap vaccine from 16 weeks. Most guidelines are either 16 or 20 weeks up to 36 weeks. So if you look at the original CDC guidelines, say from 27 weeks to 36 weeks. But in Ministry of Health is a policy. So they want to give the Tdap vaccine from 28 weeks to 32 weeks. It does not mean that if the patient come at 33 weeks or 34 weeks, they may not give the vaccine. But because it was just being rolled out, so at the moment, they're giving the vaccine from 28 to 32 weeks. But the vaccine has been shown to be effective and safe, even if it be given much earlier than that.
So what happens if the mother take early 20, maybe 60 weeks also not?
It's the same. So when the mom is given the Tdap vaccine, so the premise is the mother will need antibodies. So these antibodies will be passed through the fetus in the womb through the placenta. And then the baby will get the maternal antibody. And when the baby is born, so there's passive antibody from the mom, and it will protect them against a vaccine protected disease. So like this one, we're talking about pertussis, to protect the baby right from the first breath and the first 3 months when the baby is still vulnerable, because the vaccine for the baby from Tdap, which is quite similar, Tdap is diphtheria, tetanus, pertussis, will be given from 2 months onward. 2 months, 3 months, and 5 months. Be completed only 5 months. So the baby is not fully completed until the complete series. So the maternal antibody will protect the baby before their primary series.
All right, thank you, Professor. Okay, Datuk, we know that some expectant mothers today choose to receive their antenatal care at private facilities. However, when it comes to important maternal vaccinations like Tdap, could you clarify whether mothers who attend private facilities are still eligible to receive their Tdap vaccination at the government clinic kesihatan like KK, and what would be the proper procedure for them to do so?
I think that all mothers are allowed to accept to get the vaccine from all of the government clinics, clinic kesihatan, and they have to register with the clinic to get it. Either they register physically there. I think they can also use My Sejahtera and register. And once they've registered, they will be on the list, and they just request for the vaccine, and they should be given. It will be given during that time phase of gestation. But then if they are before or after, they should still be given the vaccine.
So they have no problem either you go to the KK or the swasta, there's no issue, right?
No,
Have
they
you-
can
everyone can
go
get
to
the-
KK.
All right.
You can get from KK.
Okay, next to Professor Dr. Jamiyah. Before we go further, I think many mothers out there would first like to understand the basics. Professor, could you explain what the Tdap vaccine is and why it is very important, especially during pregnancy?
Well, only the mother can protect the fetus, we say. So that's why it's very important. But the mother is exposed to a lot of infection. And therefore, and the babies can be exposed when the baby is born. Now, vaccine have been shown to protect. So in Tdap vaccine, so T stands for tetanus, then D in diphtheria, and P pertussis, that pertussis. And it's much easier for them to get pertussis from anyone. So therefore, it's very important the mom to protect themselves. But for Tdap vaccine, the main objective, the goal, is sexual protection of the fetus and the newborn. So the mom, if they get pertussis, they will just have cough, like Datuk will say, just prolonged cough. You may not know they have pertussis. But if the fetus has pertussis, it can't even breathe sometimes. So therefore, when you give the mother vaccine, the Tdap vaccine, so it will mount antibody, and this antibody, as I said just now, will be transferred to the fetus, and they will protect against this vaccine-preventable diseases. In this one is tetanus, diphtheria, and pertussis mainly, because that's very important before the baby can get the primary series. Because this infection is very dangerous to the babies, especially when they're newborn in the first 3 months and they haven't got their own primary series of vaccine.
All right. When we talk about to get immunized Tdap to the mothers, what happened to babies and mothers who don't want to take any vaccine?
Well, if the mother do not want to take the vaccine, they can get infection from pertussis, let's say. So they acquire the infection from another person and they have pertussis.
Yeah.
But they mount an antibody, but that antibody is not high enough to be transferred through placenta. So it cannot protect the baby. But vaccine mounted high antibody. So they can protect themselves. They can't protect the baby if they don't take the vaccine.
Yeah, okay. We go back to the Professor Dr. Zulkifli. Why do you think the Minister of Health MOH has decided to introduce or push for this vaccination at this particular time? It is because of recent data, rising cases, global recommendation. Can Doctor explain?
Yeah, it's a combination of all of that.
Ah.
Right now, as Prof. Jamiyah said, it's tetanus, diphtheria, and pertussis. These are the 3 diseases. And the data shows that the pertussis has actually increased in the country. The Ministry of Health data shows that in, say, 2011, there were about 248 cases of pertussis, yeah? But in 2023, it's gone up to more than 1,200. So that's about 8-fold increase in cases. In 2023 also, the data from the Ministry of Health showed that there were 43 deaths. And 1/3 of that 43 actually occurred in those less than 5 months old before they have received their first doses of vaccination for the babies. So because of that and because of the high mortality deaths, so the ministry decided that this is the best option to help mothers to prevent the babies from getting infected.
That sounds really worrying, Dato', especially when you are talking about babies. Pertussis or whooping cough can be extremely serious for infant because their immune system are still developing, right? I have heard of pertussis, but what does it do to a baby?
Oh, okay. Pertussis or whooping cough
Yeah.
is a condition that infects the nose, throat, and lungs. It doesn't just infect the baby; it infects anybody else as well. So adults can carry it and be coughing for about 2 or 3 months, and they will be spreading the virus to the baby. So, it's a bacteria, kan? And and what happens is the baby will have severe cough, and sometimes it's so severe that the baby does not have time to breathe, and it can also infect the brain. It can infect the lungs and then cause more complications. So that's why it's important that we protect the babies through the mother.
Maybe you can share a bit about your experience to using the Tdap before?
For adults, yeah, when we're not pregnant, it's an example because when my daughter was pregnant, this was about 11 years ago, I took the Tdap vaccine because I wanted to make sure that I don't bring the bacteria back from the hospital to the baby.
Yeah, it's clear.
And then I made sure that my wife had the vaccine as well. And then my son also had the vaccine, so that we don't become a source of infection to the baby. And at that time, Tdap was not given to the mothers yet. So we wanted to protect the baby. So I think this is what people should be doing. The main focus should be on protecting the baby.
All right, Ismail. Okay, we can send.
But what Datuk was saying just now is what we call a cocoon. As a cocoon the baby, protect the baby and vaccinate everybody around the baby. That means it can be vaccinating like more than 20 people, no? Grandfather, grandmother, granduncle, granduncle, nephew, nieces, doctors, nurses. So difficult, more expensive. So it is more effective if we vaccinate the mother, because the baby is within the womb. Vaccinate the mother mount an antibody pass through the placenta when the baby is born, even after taking the first breath. The antibody is in the system, will protect the baby against pertussis, especially at least for the first few months before the baby gets serious. So it's direct protection. It's not direct to the baby, it's indirect through the mother, but it's more important than cocooning. But if there is not enough time and the mother took the antibody less than 2 weeks and the antibody is not enough, then of course we would advise everybody around the baby to be vaccinated. But sometimes it's not adequate time to vaccinate everybody. So the efficacy is not so high. It can range from how many people? It can range from anywhere between 40% to 70% at the most. If you can vaccinate everybody, it's okay, but you can't. And it becomes more expensive.
That's a reality a bit. Yeah.
Okay, so Datuk, how exactly do babies end up catching pertussis? Is it usually from people close to them, like family members or caregiver? And how easily can it spread?
It spreads very easily. And usually when the studies that have looked at patients who have got pertussis, they usually get it from the mother or the siblings, the brothers and sisters of the child. So and there's no issue about how it spreads so easily from anybody. You can be, for example, you can have a cough for the last 2 months,
Yeah.
and you're not concerned about it. It's just a cough that keeps disturbing you. But each time you cough, you're actually coughing out the bacteria, and that can be caught by other people. And if you have a baby who's susceptible, the baby will get it.
Yeah, they sound really worrying. Okay, we go to the next professor. How exactly does getting the Tdap vaccine during pregnancy can help protect the babies? And can you explain how to antibodies pass from the mom to baby and why this early protection is so crucial before the little ones are old enough to get their own shot?
Yeah. A good question, because we know that mothers are exposed to infection.
Yeah.
And they're slightly hyperimmune. So it's important for them to be vaccinated against the vaccine-preventable disease. So here we're talking about Tdap. So Tdap, as I said just now, so if the mother gets the vaccine Tdap, so it has tetanus, diphtheria, pertussis within that Tdap vaccine. You don't have one vaccine that's only for pertussis. If we have, it's very good. Just give one pertussis vaccine, but you don't have. So it's 3 into 1. So what happened is the mom will mount an antibody response. And this antibody produced by the mother now will also protect herself, but the goal for Tdap is to protect the newborn. So it will pass through the placenta, and when the baby is born, even the first second is born, the body already has passive antibody from the maternal vaccine of Tdap just now. So it will protect the baby right away, that particular minute the baby is born, to the next, at least the first 3 months, because the next primary series the baby will get the vaccine is at 2 months. But it's not enough at 2 months. The baby needs to get another vaccine at 3 months and completed at 5 months. So by about 6 months, the immune system will be now protective for the baby. So in that first few months, the maternal antibody is the only one that will protect the baby. Because the baby can be exposed, like what Datuk Zul just now say, by anyone. We always say, pertussis cough, it's like 100 days cough. They just cough, but to them it's a cough. They have bacteria. They pass the infection to people around them, especially the young infants who are not protected.
All right, Professor. So what happened after the baby is born? Does the protection from the Tdap vaccine during pregnancy stick around? And how long can the baby rely on these antibodies before they start their own vaccination?
Study shows that the protective effect of the vaccine is maximum the first 3 months, but the antibody is still present until about 6 months. But the protection will be lower. But by that time, the baby has really got the primary series. So it will mount its own antibody. So the first 3 months is crucial. And efficacy, protective effect will be up about to 90% or so
50%?
to protect the baby against especially pertussis. Because pertussis is very easy. One person who get pertussis can spread to about 15 to 17% around them, So it's very infectious, this Bordetella pertussis, which is a bacteria.
So learning about this. Okay, Datuk, we go to Datuk Zulkifli. You mentioned that kids and adults can sometimes pass the pertussis to the baby without even realize. And so, what are some practical ways we can prevent this from happening? And we are talking about the vaccination for the family, Datuk. Hygiene habits or other strategy to keep newborn too safe everywhere, every day.
A tall order.
Well, in the first place, the mothers should get vaccinated first. That's very important. But if that cannot be done, if that cannot be done, or it's done too late, or it's done too early, and you don't have enough antibodies, then you must make sure that people who come and visit the baby is not sick. And then you have to make sure that if somebody comes and he sees this red girl, he's coughing,
Yeah, rokok one.
so you just say don't come near the baby.
Yeah.
And then you make sure that you try and make sure that at least the close relatives too get the Tdap vaccine as well, so that will protect the baby.
All right, we go to the Professor Dr. Jamiyah Hassan. So how effective is the Tdap vaccine? Really, does it give the strong protection for the both mom and baby? And are there any things that can affect how well it works that people should know about?
The goal of Tdap vaccine to the pregnant mother is to protect the newborn. So because the pregnant mothers, if they get pertussis, their infection is very mild. It will not hurt. It will not affect them very much. But the infants, yes, the newborn, yes. So the goal is that. So we have to look at data. We have to look at science. Because Tdap vaccine has been with us for more than 10 years. It started from 2012 in US. So now data has shown that it is highly effective in the first 3 months at least to protect the newborn from pertussis, from hospitalization, and from all this complication from Tdap, what Dr. Zul said just now. So it's highly effective. So and it's also very safe.
All right, maybe Professor Datuk, Dr. Zulkifli, is it good to know that Tdap immunization can protect babies from the terrible disease? You also mentioned earlier the tetanus and diphtheria. What is the tetanus, Datuk? Maybe Datuk can explain more about this.
Yeah, tetanus is a condition that's caused by a bacteria that actually is found in the soil. It can be found in rusty metal. It can be found anywhere, and you get it from a cut on your finger. In babies, they usually get it from when you cut the umbilical cord. Pusat. So it's especially dangerous because what it causes is fever with muscle spasms and stiffness of the body of the baby. So when you see in the past when we used to treat cases of tetanus, you can see the babies are stiff and hard. When you hold the baby, we cannot bend forward. So it's because the muscles are all stiff.
Yeah.
And we have to keep the baby in a corner where it's dark, there's no light, there's no noise. Because once there is slight noise, or if the light is on, the baby goes into spasm. And that hurts the baby. And they can also cause breathing, the muscles of the chest to go into spasm and stop breathing. So that's the danger of tetanus. And that's why it's put as diphtheria, tetanus, and pertussis, all three in one injection.
All right, next to Professor Dr. Jamiyah, I remember getting a ATT shot when I was pregnant, Professor. And I guess a lot of moms out there might have already had during their pregnancy too. So what happened to that?
Oh, tetanus vaccine is very important, like what Datuk said just now. But Malaysia is one of the countries has eliminated tetanus. So one on the many countries under WHO. But the tetanus is still relevant if you have a patient who has no history of tetanus vaccine or you do not know, especially the first pregnancy. That's why in Ministry of Health at the moment, if you are in the first pregnancy and they do not know the complete history of tetanus vaccination, they will give the tetanus vaccine first. It's not wrong to do that. It's okay. So it still can be given. Then subsequently, after 4 weeks later, they should be given the Tdap vaccine because Tdap vaccine has a pertussis. Tetanus vaccine is standalone. It only protects against tetanus. So first pregnancy, you get tetanus. Then after 4 weeks later, you can get your Tdap. So if they give the tetanus during quickening stage, during about 20 weeks or so, then they will get the Tdap in Ministry of Health at 28 weeks, after 28 to 32 weeks. So if you're in the subsequent pregnancy, then you can give Tdap alone because the Tdap has already incorporated tetanus inside it. So you do not need to give tetanus vaccine. However, tetanus vaccine is still relevant, so it still can be kept. But let's say the patient had only Tdap vaccine in the first pregnancy. Is it enough? Most of the time it's enough to cover because especially in Malaysia, most of our population has reached more than 5 tetanus vaccine from their newborn stage. So that means it's safe just to give Tdap vaccine. But if you're not sure, you can still give tetanus, then Tdap vaccine. But what happens if you get 2 tetanus vaccines? Is it safe? Yeah, it's safe. Data shows that it is safe.
Okay, we go to the Professor Dr. Zulkifli Ismail. So early we talk about the tetanus, but I'm curious, Datuk, what about the diphtheria? And I have heard that bacterial infection that can affect the nose and throat that makes hard for baby to breathe. Can you explain a bit more about how serious for little ones actually about this?
Yeah. The diphtheria is actually a disease that's caused by bacteria, and it what it does is it causes infects the airway and the throat and the lungs. And what happens is you get a membrane inside the airway, so it blocks the airway. So when you block the airway, the air cannot go in. So that is diphtheria. This is now, we don't see any more diphtheria in the country now, but we used to treat a lot of not a lot, but we used to treat a lot in the 1950s and the 1960s. But towards the 1970s and 1980s, when we first started work, there were no cases, except for one that I treated in the early 1980s, and that was a child who was about 7 years old, who had difficulty breathing, and at that time we did not diagnose diphtheria because we never heard of it, because diphtheria was already gone. It's gone. We give back vaccination, but this child came from a community that did not want to give vaccines. So because of that, this child and the whole community did not get the vaccine. So this child came in, but we did not manage to save the child. But because we made that diagnosis, then the Ministry of Health went to that community and gave everybody the vaccines. So that will be to protect it so that there's no more bacteria circulating.
Yeah. When we talk about vaccination, that's what's or not. I know that some moms out there might be a bit worried about the Tdap vaccination, especially about whether it's really safe for baby or themselves. Can Professor help us understand how safe it actually is and what research or evidence that this Tdap good for baby and also the mother?
I understand that's a very good question because mom is always concerned about anything they take, even though medications, even though Panadol, they're worried to take. But if they're sick, you have to treat yourself. If not, the baby will also not be protected. So yes, they're concerned about the safety of vaccine. And we have to rely on data, science data. The Tdap vaccine has been with us for more than 10 years, 2012. So the data is more than 50 countries, including Southeast Asia, Malaysia, Indonesia, Thailand, and so on. So the data shows that the vaccine is very safe and it's efficacious. But of course, you must remember, we said just now, the vaccine is given from up to 36 weeks in most countries. In Ministry of Health, 28 to 32 weeks. But you have to give the vaccine at least 2 weeks before the baby is born. If not, the baby will not be completely protected. So because it takes about 2 weeks for the mom to mount an antibody. So it has been shown to be very safe. And of course, we will not recommend anything to give to our pregnant mother or anyone for that matter, even looking at medication, for example. We must ensure that it is safe. So we rely on science, of course. So we have to look at data all around the world before we can recommend. And now we are quite sure data shows that it is effective if it is given at least 2 weeks before the mom goes into labor, and it is safe. So if they get the vaccine today and tomorrow they goes into labor, of course you will not be protected. Then that's where Dr. Zun's suggestion just not protect everybody. Everybody must take the vaccine to protect. It's cocooning, we call it. But then it's not enough to protect everyone, and it become very expensive. So this track record now shows that it is safe.
Or my last question to Professor, following up on that, Professor, some mothers might be concerned, could receiving the Tdap vaccine during the pregnancy have any impact on their own health or the baby well-being? Are there any side effects they should be aware of if, let's say, the baby and also the mother take the Tdap?
Very good question. Because CDC look at all vaccine, not only Tdap vaccine, all vaccine given to all the population, and they track safety data. So if there are any concern, any reports, anyone can report. Even in Malaysia, they say you can report to the MPRA about any safety data. So far, the Tdap vaccine has more than 10 years. The majority of patients just have very minor side effects. It's just only local skin effect, pain or some redness. Rarely they get fever. So the major side effect is we do not see any complications toward the mother, neither has any problem to the mother. So in that respect, the vaccine is very safe.
Maybe there's some example is a Datuk lah, who take the Tdaps before 11 years ago, right? So maybe the last word from Datuk to share to the audience about this vaccine Tdap is a good to everyone and safe to everybody. Maybe Datuk can share a bit to the audience.
Yeah. Tdap when given to the mother, it's just the antibodies from the mother that goes to the baby. So there's no harm to the baby. And it's been shown that it doesn't cause any problem to the pregnancy, it doesn't cause any problem to the mother, and the babies are born well.
Yeah.
So I think mothers should not be afraid of getting the Tdap vaccine. But if they have a problem, they cannot get the vaccine early, or they have a problem with getting the vaccine, then the others around the baby should get the vaccine given before the baby is born or just after, so that you protect the baby from all around.
All right, thank you so much, Datuk. Maybe, Professor, your last word to the audience?
I just want to stress the mother, they are the most important people to protect. Their pregnancy, the unborn fetus, and the newborn. We're here to help them make that protection happen. So I hope mother feels safe with us. We can protect the newborn from pertussis and any other vaccine-preventable diseases.
This conversation has been incredibly informative and eye-opening to all expectant mom out there. Remember that this vaccine can help protect your baby from pertussis. It is available at government clinic and is recommended between 28 weeks and 32 weeks of pregnancy. It is truly one of the most important steps you can take to protect your baby from the very moment they are born. A heartfelt thank you to our esteemed panelists, Professor Dr. Zulkifli Ismail and Professor Dr. Jamiyah Hassan, for taking time to join me, Mas Romala, in discussing such important health topic today. Thank you so much for tuning in today. For more information, don't hesitate to talk to your doctor or can visit www.immunizeforlife.my. Bye, jumpa lagi.